Hello, this is Health Review and you're welcome. Glad to have you again on the show today. I am Chika Onyesi, your regular host. This episode is going to be very enlightening as always, but more so because there is a health threat around the FCT now. Meningitis is upon Nigeria again, and this time people are dying. Now there is a threat of an outbreak in the FCT. How true is this? Should we be worried about an impending epidemic? What precautions should we put in place to protect ourselves? All these and more on Health Review today. Thanks again for joining us, and wish to apologize for starting the program a little behind schedule. Okay, remember to send your contributions to our Twitter handle at Health Review STV and to our Facebook page, Health Review on STV. The most important news around the globe now, or especially in Nigeria, is that meningitis is killing. So we're going to skip the health stories that we had packed for you today because we're in a bit behind schedule, and go straight to the point. Let's take a quick break. When we return, we play you a short report, to give you an intro on what exactly is happening in the FCT in terms of meningitis. Don't go anywhere. Stay with us.
Silverbird Television.
The point is this, is the executive branch. The president has...
Me, Segun Ojomo. On this program, we'll be bringing you news, views, and exclusive interviews.
A week ago, about 16 persons were confirmed dead from meningitis in Niger State, while there were also reports of a suspected outbreak in Sokoto State. Now, there are rumors that about 4 persons may have died from meningitis in the Durumi area of the FCT. Without the benefit of investigation into the deaths, the Public Health Department is now compelled to initiate an emergency meningitis vaccination.
This is an index case where we have the death, and there are suspected 4 cases of cerebrospinal meningitis death, which have not been investigated. So we don't want it to happen. All the schools have been vaccinated around there, those suspected schools, and investigation is going on to find out whether these people travel to Niger or Kano or Sokoto, where there is an outbreak. So we are doing that now. Our disease surveillance officers are doing that to confirm whether the father or the mother or the children travel out of Abuja.
The failure to conduct the necessary tests on the suspected cases also raises concerns about the crop of doctors currently in the medical practice.
When we graduated from schools, we are supposed to have done about 20 lumbar puncture for each medical student or doctor before you become a doctor. But this time around, the doctors were not eager to do it. If they have done that lumbar puncture, if it is one out of the 4, we'll have known whether it is meningitis or not. They are not confirmed because they die and buried. No investigation was taken.
The meningitis vaccine is being administered on persons from 1 to 29 years. While there is warning for people to avoid crowded places and improve ventilation, the vaccination drive will target slums, barracks, and the IDP camps.
Easily it can be transmitted, contagious infectious disease. It can be transmitted through breathing in and out, or coughing and sneezing. So something that can be done, actually inform the public to be able to have cross ventilation in their houses to prevent the occurrence of meningitis. Now they should use the opportunity to vaccinate the children where we are. But we're not going house to house. But we also have to make sure that polio vaccine is given to all the eligible children.
So far, only about 70,000 doses of meningitis vaccine have been made available for the week-long vaccination drive.
Okay, that's the information we have on the suspected outbreak of meningitis. But not to worry, we have a guest in the house who is going to throw more light on where we are presently in the FCT and countrywide in terms of meningitis outbreak. Our guest today is Dr. Sebastian Esomonu. He's a public health physician and the head of planning, FCT Primary Healthcare Board. So you're welcome to the program.
Thank you.
Okay, sir. We don't have much time. We just want to go straight to the questions and discussions that we have on meningitis. So there's no doubt that there's an outbreak of meningitis in Nigeria. How alarming is the situation?
There's an outbreak of meningitis in Nigeria. It has been confirmed. And presently, where we have confirmed cases of meningitis in Nigeria are in Sokoto State and Katsina States. But other states have been having cases that look very close to meningitis but have not been confirmed, just like in FCT, they have not been confirmed. But confirmed cases are in Sokoto and Katsina State.
Okay, can you run us through the figures, the casualty rates and the statistics? Do you have that information?
Yes, in Sokoto State, as at now, or as at yesterday, we have 23 persons confirmed dead in Sokoto State, while in Katsina we have 36 confirmed deaths as at yesterday. And then hundreds of other people are also confirmed infected, but they are not dead.
What of in Niger State? We have issues in Niger State, very close to us here. How many figures are we looking at in Niger State?
That of Niger State, we don't have them. We don't have it for now.
Okay.
I've only given you the ones that we have.
Okay. Okay, so in terms of meningitis, who is at risk, and what zones of the country are most prone to this outbreak?
Yes, talking about meningitis, in Africa, there is a belt, we call it meningitis belt, that stretches from East Africa to West Africa. Okay. And Nigeria happens to fall in this belt. Okay. And it is mostly seen in areas where you have deserts and hot climate. Oh. So if you bring it down to Nigeria, the areas around the northern part of Nigeria are mostly at risk. But that does not mean to say that other parts of Nigeria are not at risk. But more at risk in the northern part of Nigeria.
In other words, the present hot weather that we're experiencing could be said to be a contributing factor to the outbreak. Is that so?
Exactly. Meningitis, either bacteria or viral infections, thrives more in dry, hot weather. And the time of the highest risk of infection is from December to June of the year. So the weather is a contributory factor to the epidemic. Okay,
let's talk about symptoms and signs of meningitis. What should I be looking out for if there is an outbreak like this? Everybody is afraid that there might be something. In fact, a colleague this morning told me that she was having neck pain, so she was afraid. Could that be a sign too? Okay,
meningitis, we have the commonest signs for meningitis, and this includes high-grade fever. Okay. Fever up to 38 degrees centigrade or more. Okay. And then you have headache, very severe headache, and neck stiffness, plus or minus vomiting. So for somebody having neck stiffness alone and thinking that meningitis, no, that does not apply. The person has to have fever, high-grade fever, headache, and plus or minus vomiting. Then there are other minor symptoms, especially in children. You can have drowsiness, irritability, the child cannot be consoled easily, and poor feeding, the child is not able to feed. So these are the signs and symptoms you look out for in meningitis. Okay, so
there are rumors that meningitis is upon us in the FCT. Health officials like yourself have said that there are only suspected cases. They've not been confirmed. But just this morning again, we've heard news that some people have died in Kuje, Buhari and Gwagwalada. So we don't know how true is this. Are these ones that have died recently also from meningitis or not confirmed too?
People have been dying even before this outbreak came about. So any death should not be attributed. Remember the time of Ebola. Anybody that dies in Nigeria, they'll be talking about Ebola. So we know that there is meningitis, and people have been dying even before now. So the deaths that were recorded and we are suspecting, and the one that happened in Durumi, and there are 4 of them in Durumi that we are suspecting that they are meningitis until they are confirmed. Every other one still remains under suspicion, but they have not been confirmed in FCT. Okay,
are there steps to confirm them? They said they are still suspicion. How long are we going to call them suspected cases? How long will they be till they are confirmed? Even the ones that happened this morning in Kuje and Buhari?
If the samples are taken for laboratory investigation, that is the blood sample or secretions from the nostrils and throat, you're taken to laboratories for analysis. The results should be able to come out in less than 48 hours. So we're hopeful that the results will come out. And as soon as the results come out, we are going to be released and people will be made to know about it.
In other words, you're saying that government is already, the test and investigation is underway?
Yeah, samples has been collected and sent for analysis.
Okay. Okay, so let's go to government intervention in terms of meningitis. What exactly is government doing? Because the fear is palpable. People are afraid that since it's a viral infection, bacteria on air, droplets and all that, it could spread. If it gets into Abuja, it could spread. From a place like Durumi, very close to town, we're afraid that. What interventions are in place to make sure that it doesn't come close?
First of all, we have to put up a lot of public health awareness for people not to panic. Okay. You are having the notion that it spreads by air, but it doesn't spread like tuberculosis, that somebody can be here and throw it far away.
Okay.
You have to be a very close contact of that
Okay.
person.
So
When
you
the
see.
person sneezes, you get it immediately.
Okay.
So there has to be this calming of nerves among the people that it doesn't spread so fast as people are thinking. It has to be by close contact. And then what we are doing, apart from the public health awareness that we are creating, there's massive vaccination. Vaccination, because you have to give people that immunity to resist the infection, even when they are close to the person that is having it. And then there's also the angle of drugs for using for prevention. We call it prophylactic drugs. You give people who are close contact. You don't give it to everybody.
Okay.
People have been confirmed or suspected to have meningitis. Those who are around that person, the family members, caregivers, everybody around that
Okay.
person can be given drugs like rifampicin to protect them against the infection of having it. It's not something you throw in the public and give everybody. It's only those around confirmed or suspected cases that you give it to.
Okay. Have those drugs been given to the families of those whose victims or family members have been suspected to have died from? Are these drugs available? Have government made them available?
Rifampicin is a very common drug, and
Okay.
it's not something that you look for. I'm sure those managing the cases would have given the drugs and the vaccines to protect those around the suspected cases of meningitis that we have in FCT.
Okay, sir. We have Niger State, Nasarawa State, and other states bordering Gwagwalada just a little bit after the FCT bordering us. Are there measures from the FCT Public Health Department to ensure that these cases that are being recorded, especially in Niger State, are not imported into the FCT?
Yes, there is collaboration, health collaboration interventions that we are doing among the neighboring and contiguous states in FCT to create the awareness about the disease and also give them whatever intervention that we are giving in FCT to make their states also key into the intervention that we are giving. The commonest intervention is meningitis, vaccination. So the states that are contiguous to FCT are also in the campaign of vaccinating their people, especially people, the vulnerable group. Remember, it's not everybody. People who are vulnerable, prone to have this disease, like the children and the adults below 30 years. We are targeting those groups to vaccinate them. Other adults is not very common in them.
Older. Okay.
Yeah.
Okay. So I was talking to an expert the other time, and he said avoid crowded places, ventilation, and all that. What is the plans for places like IDP camps, where you know that crowds are inevitable? Churches, schools, hostels, or places where they use public sanitary facilities like toilets and all that. How do people manage in such places?
The issue about overcrowding is where there is outbreak.
Okay.
Yes, overcrowding, we are not saying people should not go to churches and schools where there is no outbreak. It is where there is outbreak.
Okay.
There is the advice that people should keep away from public places where there is a confirmed outbreak of meningitis. So, and when you confirm it, people should not gather so much. And where people are living, people are vaccinated where they are to prevent them from getting. The key there is vaccination. Vaccination, vaccination, vaccination. Once you vaccinate, we will tend to achieve between 80 to 85% level of vaccination. That is amongst 10 people. If up to 8 people are vaccinated, it covers the remaining people.
Do we have enough vaccines?
We have vaccines. We have enough vaccines, particularly meningitis vaccine. We have them for the targeted age group, not for everybody.
Okay.
Yes, for the targeted age group. That is where the vaccines are going.
Okay, I have, briefly, sir, I have a challenge with the issue of the deaths that were recorded. Now, we still call these victims suspected cases because no investigation was conducted when they died, even after all the symptoms were presented. Now, I'm wondering, those facilities where the victims died are manned by doctors or health professionals. Is it not possible to bring justice to the doctors who did not do? I understand that medical personnel, they are supposed to do what you call the lumbar puncture.
Okay.
And this lumbar puncture was not done. So we don't even know if these people died of meningitis. That's why we abandon suspected all over the place. So what happens when doctors don't do what they're supposed to do?
Okay. The lumbar puncture, it is for when you have this high index of suspicion. You remember there is no outbreak in FCT. So nobody was suspecting that these are likely suspects of, likely candidates of meningitis. So maybe that's why lumbar puncture was not done. But meningitis virus or bacteria could be cultured from blood. So blood samples as well could be taken. Like I told you, throat swab, nasal swab can be taken for culture. So it's not only when you do lumbar puncture that you can diagnose the bacteria. So if those doctors did not do lumbar puncture, probably because they didn't have this high index of suspicion that these are likely to be cases of meningitis. That's why they did not do lumbar puncture. It happens once in a while, so they should not be crucified. But the important thing is that other samples could be taken to also go and look for the bacteria that is causing the problem.
Okay, one word, sir. One word for the audience. There is fear in the FCT that meningitis could spread. One word for the audience, sir.
Yes, the word there is no need to panic.
Okay.
There is no need to panic. We don't have outbreak of meningitis in FCT. There's no need to panic. And then people should reach out for nearest health center or hospital where they can get vaccinated, particularly those in the age group, the targeted age group. That is the advice I have for them. No need for panic. People should go for vaccination. The personal and environmental hygiene, avoid sleeping in crowded places, and all that. So that is the message.
Okay. Okay, thank you very much, sir, for honoring us, honoring our invitation to be on the show today. Okay, I have been speaking with Dr. Sebastian Esumonu, a public health physician and the head of planning, FCT Primary Healthcare Board. We have been talking about meningitis on Health Review today. Okay, the doctor says that meningitis, there is no outbreak of meningitis in the FCT, even though there is meningitis in Nigeria. But basically, everyone who is within the age range of 1 to 29 years should go and get themselves inoculated. Take the vaccines. They are free in medical centers. Go and take the vaccines to protect yourself from meningitis. Okay, it's been Health Review. We will now leave you with our healthy living tips on how to avoid meningitis. Thanks for watching. I'm Chika Onyesi. This is one of the hallways of the